Good morning, bows and bow ties. So, look, I want to talk about Dr. Jackie from Married to Medicine. As you're aware, I've made it clear before that I've really stopped watching many of these shows for quite some time because I don't believe there's any sisterhood there. I don't like the representation of Black womanhood on many of these shows. But I want to lean in on this for a moment. I was minding my own business. I woke up this morning and I decided to get on the TikTok for a few minutes because I do find joy in watching some of these cat videos and lion videos and just anything funny that's going to make me laugh. Okay. But over the last couple of days, I've seen several clips of um, people reacting to uh, she she has basically did a live with Dr. Heavenly. She's the dentist on that show, and she made some comments about Black pregnant women. And let me just say this: she already turned me off years ago with her behavior towards Buffy personnel. Okay. There was a woman who came on the show. She was a friend of the show. She was a friend to, I believe it was Dr. Simone. And basically, she outs Buffy for being or having fertility issues. And as a doctor, that's a huge no no. And she tried to, make light of it because she had her own infertility issues. I'm talking about Dr. Jackie. But the way she treated Buffy and she treated her like she was a piece of trash, instead of owning the fact that she was out of line, she made it seem like I made a mistake. I'm sorry, that's it. And I'm like, whoa, that's how we treat women? That's womanhood? So let me fast forward to now. She made a comment about Black women who are pregnant. They complain too much, during their pregnancy. And I'm like, whoa, whoa. Um, for a woman who has never experienced pregnancy, how dare you? Especially when Black women are never, um, let me rephrase that. Black women, people don't like to hear Black women. They don't like to listen. They don't take them seriously. There's a reason why Black women have the highest, mortality rate when it comes to those who are birthing children. I'm like, if she knows this, let me just say for the record, nothing about her makes me say I want to even come into her office. Nothing. Okay. I don't know why people are continuing to go into her office. I think the only people who are probably going into her office are those who are probably looking for some sort of clout or something. Nothing about her says warm. Nothing about her says safety. Everything about what I'm seeing on television, the way she's moving, says, I'm here, I've arrived. I just want to promote myself. I just want to promote my products. And there's nothing wrong with that. Um, there's nothing about her that says, I care about these women, these babies. Now, I suspect on some level she does, but I think anyone that comes to her office now, they're just nothing more than a means to an end. I am so turned off. Let me tell you something. I am a mother of four children. All of my children were born early. 100% of my children were born between 35 and 36 weeks. Three of my four children have been in the NICU. I remember I was pregnant with my first child. I don't remember my doctor for my first child because I wound up switching. And I called and I explained things. And he told me to come my way. I had excellent care, but I don't remember my doctor. But I remember my doctor for my last three children. I went to this particular practice, and there was, there were, I can't remember if there was two Black doctors and one white doctor, or three Black doctors. I don't know why. I know there's a third doctor, and I know she was a nurse practitioner. That's what it was. And there were two Black doctors. One, I did not like her. I didn't like her bedside manner. I just found her to be stressful, so I didn't deal with her. And then there was this other doctor. We called her Doctor. I'm just going to say Dr. D. I don't want to say her name. She has a very unique name. And she wound up moving to Dubai or something. And, I would come in and I would tell her the things that were bothering me. She was never pregnant, by the way. You know what? She listened to me. She listened to me. I remember I left work for a routine appointment. This is for my second child. And I came in, routine appointment. They did their normal, blood pressure, blah, blah, blah. The doctor came in and she said, "How are you feeling?" I said, "I'm feeling fine. Just a little tired today." But she looked at me. She's like, "Talk to me. How are you feeling again?" And I was like, I don't know. She just kept talking to me for a second. She was so in tuned into me. She ran my blood pressure and everything again. I mean, she checked everything again. She said, "I want you to go straight to the hospital." What? She's like, "Go straight to the hospital." I'm like, "Why?" She was like, "You're going to have this baby today." I'm like, "I am?" She's like, "You're going to have this baby today." And I had been telling her leading until I was tired and all kinds of things that were going on. And she kept looking at things. She's like, "You're not going to go full term." She's like, "I need you to stay in contact with me. Let me know how you're feeling." All these other things. She kept running all the right things. But you know what? She listened to me. But when she looked at me that day, she was like, "I don't think you know how sick you really are. You're going to have that baby today. So you can leave your car here, drive yourself. I think you're fine to drive yourself. But I want you to understand, you got to go straight to labor and delivery. Do you understand me?" I was like, "Yes." She's like, "Go straight to labor and delivery. You're going to have this baby today." She explained all the things. I called my husband. She was like, I said, "Well, what are you doing?" She was like, "I have to not close up, but she's like, I got to chart or whatever she had to do, something minor." But she was like, "I'm not too far behind you." I was like, "Really?" She was like, "Yes." The other doctor wasn't the nicest. I would tell her, like, I think she had to take one of my appointments one time because my doctor was out that day. It was like a last minute, like she had to go deliver a baby or something. And I had the other doctor, she looked me over, but I was just like, "I will not deal with this lady." No. The point I'm getting at is Dr. Jackie knows Black women, they are having a rough time of it delivering these babies right now. And for her to use that platform to get out there and say that Black women are complaining and whining and crying or whatever it was she said, I was just really just disgusted. This woman is evil. And I know there are many of you out there who have never had children who are going to sit there and try to make excuses. Let me tell you something. If you have never walked in these shoes, and look, I've had 4 kids, you don't know what it is like. You don't know. I don't know why it struck so hard because there's lots of things that people say and do, and I'm just kind of like, they just don't know. But I was like, wait a second. This is your profession. And all I see is her like servicing these high end people. What about the people of the community? Rumor has it she doesn't deal with us regular old Black folk who have insurance, right? And now I don't know what's true. This is all alleged, but it was such a turnoff that this woman, who was held in such high esteem, get out there on Jesus's internet and make a comment like that. Now, this is the thing. I don't want to totally eviscerate this woman because this is a whole Black woman, but she definitely, that was a misstep. I was never a big fan of hers anyway. I have my own reasons besides the ones I mentioned, and some of them are like really petty. And I don't want to go there because you guys are going to be like, "Really? Really?" I'm like, "Yes, really." But I think the biggest thing was, I'm like, you, whom much is given, much is required. And I'm sitting here thinking, like, you've been given this platform, and that's what you want to put on television, knowing that Black women, their mortality rate is not the same as others who go to have babies. Shame on you. Shame on you. You know, I saw a clip where Buffy responded to it, and I was like, well, good on her. I think she called it right. I'm sure there was a little bit of a personal uh, vendetta in there too, but I think she got it right. I was just stunned, stunned that this woman would get out here and say something like that. Anyway, that's it. I don't want to say too much more on that. I think you get my message. Um, Let me know what your thoughts are. Uh, she was out of line. She was out of line. Out of line. I hope you guys all have a good day.